Well, hello. Welcome, everybody. Thank you all for joining us tonight. This is the 2022 California State Capitol Day. This webinar is being recorded, and you are all muted. You are able to, we will have a Q&A section at the end. You can also utilize the chat throughout the program tonight. This is our 9th California State Capitol Day and our second year in a virtual format. So each year, AFSP State Capitol Days are conducted in every U.S. state, bringing advocates like yourselves together with state and local public officials to share information about suicide prevention and urge that suicide prevention be made a priority. It is our advocates like yourselves who make their voices heard that will often make the difference. Because of these personal connections between advocates and our lawmakers, state bills have been enacted. Examples are requiring suicide prevention policies and personnel training in K through 12 schools, requiring insurance plans to treat mental health and physical health equally, and creating statewide suicide prevention offices and task force. So an example from my own personal local state senator, Anthony Portantino, he authored SB 972, which was a pupil and student health identification card bill. It allowed for the suicide prevention hotline and text line to be on the back of student IDs. We supported that bill in one of our previous Capitol Days. It passed, and it was enacted and actually picked up by other states throughout the US. So that's an example of the work that we do. Over the next 90 minutes, on the next slide, you will see our agenda, and we will cover suicide facts and figures. We will cover both the US and California. We'll go over Advocacy 101, which is the basics of advocacy, and also share how a bill becomes law. We'll cover the California public policy priorities that we're going to be focusing on for this year of 2022. With that, we will have a guest speaker, Lauren Fink. She's from the Kennedy Forum. She will cover the important state funding that's needed for 988. The 3-digit phone number that we're looking to transform, or we are going to be transforming the 7 digits to the 3 digits of 988. We're also going to cover AB 1394, which is suicide prevention in health systems. So we're going to talk about how you can take action and be a participant and an advocate in our State Capitol Day. And we'll also have time for questions and answers. So thank you for attending tonight. You are a strong voice and an advocate for suicide prevention and mental health, and we do really appreciate your efforts. On the next slide, I will show you as a resource, we will have 2 moderators this evening helping work the chat, so feel free to engage with them. Valerie Kovakovich and Louisa Roque will be our moderators for tonight. So with that, we'll go ahead and get started. Thank you again.
Hi, everyone. My name is Christina Capello. I am the area director for the Greater San Francisco Bay Area chapter of the American Foundation for Suicide Prevention. I'm here today to tell you a little bit more about the facts and figures surrounding suicide. When talking about suicide, it's really important that we're using safe messaging. AFSP advocates come from many different backgrounds. Some have lost a loved one to suicide. Some have had their own struggles or are supporting somebody that struggles. And some are professionally invested in this space through their work. Telling your story can save lives, but only if you share it safely. Sharing your story lets people know that they are not alone, and it shows them that recovery is possible. If done safely, your story will encourage people at risk to seek help. Some things to remember. You should be in a safe place in your recovery when sharing your story. Avoid discussing details and method, as this could be triggering for those around you. Avoid glorifying suicide by using terms like successful attempt, but instead say death by suicide. Avoid using the word commit, as we often relate this word to crimes. Instead, say somebody died by suicide or someone took their own life. Share mental health resources, such as the National Suicide Prevention Lifeline or the Crisis Text Line. And finally, practice. The more comfortable you are sharing your story and talking about suicide, the more we can break the stigma that's associated with mental health and suicide. The Centers for Disease Control and Prevention collect and shares data on the number of suicide deaths in the United States each year. It typically takes about 2 years for this data to be published, so the most recent data that you see here are from 2020. Suicide is the 12th leading cause of death in the United States. In 2020, we lost 45,979 Americans to suicide, making it the third leading cause of death for ages 10 to 24, the second leading cause of death for ages 25 to 34, and the fourth leading cause of death for ages 35 to 44. Over a third of those who died by suicide were over the age of 55. It is estimated that for every suicide death, there are 25 suicide attempts, which works out to be more than 1 million attempts per year. Locally in California, suicide is the 14th leading cause of death overall. For our youth and young adults aged 10 to 24, suicide is the third leading cause of death. And suicide is the second leading cause of death for those aged 25 to 34 in California. Here is a copy of our state fact sheet that has been shared with each state legislator. You can view and download this state fact sheet at afsp.org/statistics and share it within your communities as well. Now I'm going to turn things over to Alex Bird Spencer, the chair of the California Public Policy Committee and a member of the Greater Sacramento chapter.
Good evening, everyone. It's very nice to get to speak to all of y'all, and I really do appreciate you coming out tonight and for being an advocate for American Foundation for Suicide Prevention. Tonight, I'm going to focus on the Advocacy 101, giving a little bit of a rundown of some of the backbones of what we do. So by advocating for issues you care about, like suicide prevention and mental health, you can make a difference. AFSP provides advocates the opportunity to share your story and make connections with lawmakers at federal and state levels. We also provide a platform, the AFSP Action Center, to email legislators directly. Advocates can also advocate in the future and at in-person events locally and across the country and in Washington, D.C. AFSP volunteer field advocates make an impact in many different policy areas for suicide prevention and mental health. Policy priorities are determined every 2 years by the National AFSP Public Policy Council and the Public Policy Office staff in Washington, D.C. Staff work with chapters to determine where the gaps are and which policies will make the biggest impact for each state. Visit afsp.org/priorities to find more detailed information on our top policy issues and to see and download our full list of priorities for the next 2 years, the 2021 to 2022 Public Policy Synopsis. First, for those who may be new to advocacy, we want to address the question, where does legislation come from? It comes from the legislators themselves based on their personal experiences, passions, and interests. And it comes from you as advocates and constituents. It also comes from organizations like AFSP that work directly with legislators and other leading mental health organizations to write new policy and provide resources to support future legislation. Once a legislator has an idea for a bill, they will draft language and introduce it. Once introduced, the legislation is assigned to a relevant committee within the House of origin. This is either the House or the Senate. For example, if we work with a senator to introduce a bill to have all teachers trained in suicide prevention, that bill's House of origin is the Senate, and the bill will be sent to the Senate Education Committee. The committee then has the opportunity to review, edit, and vote to approve the bill's language before sending it to the floor for a full vote. If the vote is voted on favorably, it will go to the other house. So our teacher training bill, for example, is approved in the Senate Education Committee, would go on to a vote by the full Senate. And only if the Senate votes favorably on it would it be moved to the House to go through the same committee review and floor voting process. Only when the bill has been voted on favorably in both houses, it can go to the governor to be signed into law. Once received by the governor's office, the governor typically has a set number of days to act on the bill by signing it or by vetoing it, or vetoing all or part of the bill and sending it back to the House and Senate for additional edits and recommendations. In many states, the governor can also choose not to sign or veto a bill and can instead allow the bill to become law without signature. When you are speaking to a legislator or their staff, it is important to be polite and thank them for their time. You also want to be mindful of the language that you use as we discussed before, and be brief with sharing your connection to the cause. Think of it kind of like an elevator speech. For this, I want to actually provide you all an example of my elevator speech. Hello, my name is Alex Burt Spencer. I have been affected by suicide too many times for someone who's in their 20s. When I was only 18, my partner attempted suicide and I was the first responder. In that moment, I had no idea who to call or how to get help. Since then, I have worked with American Foundation for Suicide Prevention to promote policy and education in suicide prevention efforts. I look forward to sharing more information with you about local AFSP chapters and how we can work together to prevent this leading cause of death. I am so happy to answer any questions you may have. In your communication with a legislative office, if you don't know the answer, remember that is okay. You can always say, I don't know the answer to that right now, but I would be happy to find out and follow up with you as soon as I have the answer. This provides you an excellent excuse to maintain communication with that office and further position yourself as a resource for them. There are also a lot of ways to build relationships and stay connected with your lawmakers. Throughout the year, you can email and call them through the AFSP Action Center. You can tag them in social media posts, meet with them or their staff virtually over the phone or by video, and sign up for newsletters so you know when they are hosting town halls and events in your area. Many town halls and legislative meetings are now being held virtually and offer increased opportunities for advocates to become engaged in the legislative process. As you begin your advocacy journey, it is important to know what resources you have at your disposal. State legislative websites offer several resources to advocates. You can identify your legislator and their contact information. You can see what laws are currently enacted and search for legislation that has been introduced in the current legislative session. And advocates can also sign up for newsletters and find out what relevant events and advocacy opportunities may be coming into their areas. If you are interested in learning more about specific policy areas that AFSP works on at both the federal and state level, there are several resources available to you. The Public Policy Office has hosted and shared policy-specific webinars, filmed sample meeting videos for new advocates, and created issue briefs for each policy area that explains AFSP's policy position and shows what laws are in place for each state. You can also visit the AFSP Action Center at any time to see what legislation AFSP supports and where bills are in the legislative process. And now we are going to talk about the policy priorities. First, we will be hearing from Lauren Fink from the Kennedy Forum. We are very honored to have Lauren here with us tonight. So Lauren, please take it away.
Hi, my name is Lauren Fink. I'm a policy advisor with the Kennedy Forum. Very happy to be here speaking with all of you tonight, and just want to thank all of you to begin with your interest in advocating for these really important policies. Legislators do really hear and respond to your stories and your advocacy, and so it is just so important. So just thank you to all of you. So to begin, I'd like to talk a little bit about a big effort that the state is undertaking, and mental health and addiction advocates everywhere are really pushing on, which is 988. So go to the next slide. So 988 is going to be the new National Suicide Prevention Lifeline number beginning in July of this year. So, beginning in July, the old 1-800-273-TALK number and 988 will be the same, right? So if you call 988, it'll reroute you through the National Suicide Prevention Lifeline. This was put into law by the National Suicide Hotline Designation Act in 2020, unanimously signed by Congress and then by the president into law. And so 2020 to 2022 may seem like a long time, but it is not a long time in policy land. And so states have really been tasked with very quickly trying to get their systems up and running so that they can respond to 988 appropriately. And next slide. So the components of the lifeline are someone to talk to, which means when you are calling, someone will pick up that phone, which means that 24/7 crisis call centers, which are the current National Suicide Prevention Line centers, will be able to respond to those calls. The second thing is someone to respond. So the majority of crisis calls to these call centers are resolved over the phone and never need an in-person response. So I think it ranges in the 80 to 90% range. So for that percentage, a smaller percentage of folks that do need someone to respond, we really want to focus on appropriate responses. So trying to move away from police encounters or from encounters that can be re-traumatizing to folks or would prevent folks from even calling in the first place, right? We want to make sure that people are getting the appropriate clinical care that they need for their emergency crisis. So if it's a behavioral health crisis, they deserve a behavioral health response. And that would be through mobile crisis response teams. The third thing is in this 988 crisis continuum is somewhere to go. And so that is places to go that are not the ER or not jails, which are the two main places that people may end up in if they were in a behavioral health crisis. So we really want to move towards building crisis receiving and stabilization centers. So, care that is under 24 hours. And then if you need care that is over the 24-hour mark, that you're getting put in appropriate clinical spaces. So those are the three components of a 988 crisis response system. And states are sort of tasked now with responding to the federal legislation to make 988 a number and really build this out in the state. So this is, if it sounds like a huge effort, it's because it really is, and it's really requiring an all hands on deck response from states and advocates. And that's why every every advocacy day, every person that calls in to make legislators aware of how important it is really important. Sometimes we will talk to legislators, and at this point they do mostly know that 988 is a number, but they don't always know what it is or what it means. And so that's sort of the level of walking into offices or you know, taking virtual calls or whatever that you may be seeing with the legislature, is that they may be aware that it's a number, they don't know what it means or what the 988 response system should look like. So there's someone to talk to, someone to respond, somewhere to go is a really key thing to make sure that they understand. And each of these pieces is so important and requires you know, funding and comprehensive build out. And so I'll get to that in a second. Lifeline crisis centers have been found to be very effective. They are the first line of defense. They are open 24/7. They are giving appropriate care if someone is calling and maybe is not in a crisis and maybe needs something more like a warm line. They can appropriately move folks into the appropriate line. So a good example that I always like to use is, you know, if you're calling and it may start out as a crisis, right? But it may end up in a much better spot. And so they may want to be transferred to something like a specialized line. In California, we have many of those. We have local LGBTQ lines. We have Native American hotline or warm line, I should say. We have specialized lines that the state has built out, and we also have a huge warm line build out in the state called CalHope. And so these are all lines that they're not getting replaced by this crisis line. These crisis lines are for crises, and they can move people into other warm lines if needed. And so they're really effective as a one-stop shop when people are using their phones and calling in. Next line, or slide, I guess I should say. Thanks. So a big part of these call centers is they're actually not funded by the state right now. They get a small amount of funding every year for various operations, but they are generally on their own for funding, which is a little bit different than the other pieces of what we would think of as a crisis continuum, like places to go. California has already taken a number of steps to make sure that we are ready as a state beginning in July of this year. As part of this launch of 988, inevitably it's an easier to remember number, right? And there's going to be a targeted marketing campaign around it at the national level and perhaps the state level as well. And so there will be an anticipated increase in volume just in year one. So the California call centers anticipate that there will be a 300% increase in volume in year one. And so as part of that, they will need to, they already needed to have funding to make sure that they were ready for this big line to get up and running. But with this 300% increase, that means an increase in staffing, an increase in building out their infrastructure, an increase in really their whole operations. And so we've asked the state for funding to ensure that this line is ready to go 24/7 to respond to that increase in volume starting July 1 of this year, or July 16th of this year. So last year, as part of this effort, California, the state already appropriated $20 million to prepare our existing network of the 13 call centers for the 988 transition. The call centers needed, and they estimated they needed a bit more than that, and so we can talk about that in a second. But this 20 million really allowed for the crisis centers to get themselves up and running. So we do always like to thank the state and the legislature when they've helped us previously. This is a great first step, but it's just the first step. Next slide, please. So before we click the play button on this, so currently AB 988 is the legislative vehicle. So Alex was just mentioning how a bill can move through the legislature. AB 988 is the 988 bill, and it's sponsored by Rebecca Bauer-Cahan, and she has pre-recorded a description of the bill and what it does. So it might take a second to get up and running, but I'll have the video play. So whoever's in charge of that, I don't know. I don't have the capability to play it right now, but whoever's doing that. And then once it plays, I'll sort of finish up with some of the asks that we have in our advocacy around 988.
Hi, everyone. I'm Assemblymember Rebecca Bauer-Cahan. I want to start by thanking the American Foundation for Suicide Prevention for the opportunity to discuss 988 and my bill, AB 988. First, I want to start by stressing how important the partnerships with grassroots groups like the American Foundation for Suicide Prevention have been for setting the table for what we envision for the 988 system here in California. The lifeline and support you provide is integral, and your expertise is needed as we embark on reshaping our mental health response system with 988. We've already found success with 988, ensuring $20 million in funding to get you all up and running so that on July 16th, 2022, we are ready to answer all of the anticipated calls. But we are not close to being done. The efforts continue as I work with the administration on securing additional funding in order to provide a full wraparound approach to those who need it most. Criminalizing mental health is wrong. It results in preventable suffering and unjust death. I saw this injustice in my very own district in the case of Miles Hall. Miles Hall was a young Black man beloved by his family and engaged in his community. He struggled throughout his life with mental health challenges. Miles's parents sought every resource for him. They reached out to the local police department's mental health officer. They tried to create a relationship between everybody in the community who could support Miles. But despite these efforts, the system, we failed Miles and his family. On a sunny June day in 2019, while working with his grandmother in the family garden, Miles had a schizophrenic episode. That day, he died at the hands of law enforcement. The officers lacked the necessary skills to care for Miles, and they were not trained mental health professionals. Miles died because we failed to provide alternatives to policing. A mental health crisis is not a crime, and no one deserves for their life to be ended when they are merely seeking help. Tragically, we continue to see the lack of comprehensive crisis response within our mental health system. Suicide attempts, mental health episodes, and other challenges often turn deadly when they're mishandled, especially for people of color and our unhoused population. It doesn't have to be this way, and it shouldn't be this way. California can be a national model for addressing our mental health crisis response. 988 enables a mental health crisis response system to appropriately dispatch teams of mental health professionals, not law enforcement, to individuals in crisis. This creates the same type of health-based response to mental health crisis that we use for all of our health emergencies. The 988 movement is evidence-based. In Dallas, Texas, mobile crisis teams made arrests for new offenses in fewer than 2% of cases. They diverted 900 people from emergency departments and just under 500 people from jail in 9 months alone. So mobile crisis response teams are doing a better job, and they're making sure we do not incarcerate our mentally ill populations. Other cities like Eugene, Phoenix, and Denver that have implemented similar programs have seen the same results, and they've saved millions of dollars in the process. AB 988 allows California to shape the response we want to see here in our own state. So what does AB 988 do? AB 988 will connect, expand, and integrate 3 critical pillars of mental health crisis continuum of care. It'll start with a 24/7 access to crisis counseling through call, text, and chat. We'll have behind the scenes interoperability between 911 and 988 for seamless crisis support, no matter what it is you need. We'll have the deployment of mobile crisis teams staffed by trained mental health professionals and peers to respond to crisis instead of law enforcement. And we'll have access to crisis receiving and stabilization services so that individuals in mental health crisis aren't left to languish in our emergency rooms and our jails. Instead, they will get the critical care they need. The National Suicide Hotline Designation Act authorized states to assess a user fee on mobile phone, landline, and other access line to fund efficient and effective routing of calls, personnel, and the provision of acute mental health, crisis outreach, and stabilization services. This is the same way that 911 is funded nationwide. The user fee established in AB 988 uses the same model of determining the rate as California's current 911 fee. We are going to work to make sure we are funding the system so that Californians have access to this meaningful care. And I want to say I'm happy to see continued work at the federal level, including recent movement from the federal government with House Resolution 5611 and Senate Bill 1902 to help us with guidance and funding. Key investments working their way through Congress include a national suicide prevention lifeline funding and expansion, largely due to advocacy from groups like the American Foundation for Suicide Prevention. So keep it up, you're making a difference and we're seeing it in action. Building a mental health care system from the edges of the physical health system is difficult, but righteous work. I wish we could have saved Miles Hall. I wish we could have saved the hundreds of people who've died and been robbed of their rights because of mental illness and our lack of care for them. We carry on their names and their legacy through this work. 988 is a critical piece in your work and the work of all the incredible advocates that move us towards the future that Californians deserve. Thank you so much for your support and for your efforts. You inspire me as we continue this fight. Together, we will make California and the United States a better and more equal place for all, including those who suffer.
Great, had to unmute myself. So she did give a great overview of the bill and what it does. So that is AB 988. There's a couple other asks that we have around 988 for the system and the asks that we have. And I can't quite see our slides, so I'll just wait until maybe we get them up so folks can look at them. Perfect. Okay, so we are asking the state to continue to dedicate ongoing state general funds. I mentioned earlier that we have about 20 million in one-time funds for first year for the call centers. The call centers have estimated they need an additional 8 million more for year one. So in the short term, that's our first ask, is asking for 8 million so that we have what we need when the lines start picking up in July. Next slide. The additional thing is also supporting the governor's proposed budget. So in January every year, the governor puts out a budget proposal. Then the legislature and stakeholders and advocates like us go back and forth around asks around that. And then there is something called a May revision in May, where it goes to legislature and then it is finalized in June. So that means that in January, the governor proposes a variety of things and funding, and it's not final until June. And so that's coming up in a couple months now. And so we're sort of in the time where we are wanting to express our support for the things that we see as important in the governor's budget. So as part of the budget, there was 7.5 million given for one-time startup costs and 6 million every year for the Office of Emergency Services. The Office of Emergency Services runs 911. And so for calls that go into 911, so if you are a neighbor and you are calling 911, but it's really a mental health response that you're calling for, 911 should be able to route people to 988. If it's the opposite, where you are calling 988 for some reason, and it ends up being like a medical emergency, for example, like an overdose, that would get routed to 911 so that they could have the appropriate medical response. So that's a really important interoperability there. And the governor's budget includes that, which is excellent. So we are reiterating that we like this and we want to see this in the final budget. The budget also has 1.4 billion for mobile crisis teams. I know that seems like a huge high number. It is. A lot of that is because the federal government is taking about 85% of that and paying for it. So the state only has about 300 million for mobile crisis teams, which is great. So we want to continue to have that in the final budget. The last item is to build out infrastructure. So to making sure that we have mobile crisis cars and teams that can go out to folks, and also for crisis receiving and stabilization services, and to make sure that there are enough buildings or enough beds or whatever it might be. The state has already dedicated or has slated to dedicate 205 million for that infrastructure. So looking at this slide, that's a significant amount of money. And that's great. And a lot of this, you'll notice, is one time. And so, we are asking the legislature to do this and to also make sure that we're putting in place a sustainable funding mechanism. So next slide. So as part of that, that would be supporting AB 988. So that requires a 988 to be 24/7. It requires care through call, text, and chat. It requires that 911 and 988 interoperability. It requires call centers to coordinate with counties and local level crisis response so that we can have a comprehensive 988 system. So I think there's one more slide left, but I'm not entirely sure. So let's try it. Next slide. Great. So 988 would fund, AB 988 would also fund the 988 system. So it establishes a special fund, and it sets up a long-term funding mechanism for 988. So it's estimated that this entire crisis continuum system could be about $1 billion a year. That is a lot of money. The state has a lot of money in its coffers right now, which is great, and which is why they're able to give us so much in one-time funding. But as we all know from recessions or other, political winds shifting, whatever it might be, having constant funding through the state is not always an option. So as part of the National Suicide Designation Act 2020, the act gave states the ability to set a small monthly fee on phone lines for the use of 988 because it is essentially a phone service. Currently, the bill has it capped at 80 cents a month, which is exactly what 911 is capped at. And that would basically make a long-term sustainable funding for 911 or for 988. Next slide. So 988, as I've said over and over again, is a big comprehensive system, and it is something that is a huge undertaking by both the federal and the state governments, and requires all hands on deck for us to make sure that we are building out a system that works for folks when they are in a behavioral health crisis. We think that, or we know, given studies and just statistics around reducing burden on emergency rooms and law enforcement, that programs like this reduce healthcare spending because we are focusing on early intervention and moving away from less costly things like an emergency room visit or jail time for some folks. It improves outcomes for people who are experiencing a mental health or suicidal crisis. I'll also add for folks struggling with addiction or co-occurring with multiple disorders, or just things that they'd like to talk about. Having a one-stop shop phone number is really, really useful for that. And it also ensures more equitable access for our crisis response system. People who are in rural areas who may not have the ability to physically get somewhere can call online. Telehealth options can be a really good thing here. And it is really helping pull away the crisis responses that we don't want to see, right? Which is violent responses or police responses, or pushing people into emergency rooms, or really re-traumatizing folks who are seeking help when they need it. And so we want to make sure that we are creating an accessible system for everybody, and that really requires a long-term planning and building of a comprehensive system all at one time. So I'll just end with a little thing that I talked about today earlier on a call, which is that there are a lot of moving parts in this system. I know it can feel really overwhelming. I think really focusing on those three things that I spoke on earlier about somewhere to call, somewhere to go, or someone to respond. Those are all really important pieces of this system, and we really want to make sure that we're funding those as a state in both the short and the long term, and that's essentially what we are asking for with 988. So I'm happy to answer questions or be a resource to folks on this call. There's crisis lines right there. This is the current National Suicide Prevention Lifeline. The crisis text line is also up there. They are not yet connected with 988, but it sounds like they may be later. So as we build texting capabilities into 988, that's important. The Trevor Lifeline has phone, chat, and text for LGBTQ youth. And then there's also the Trans Lifeline, and the number's right there. So, and that's not 24/7, notably. So those are some of the crisis lines. And I think that's it on my end, but happy to answer questions, and I'll kick it off to the next person. I'm not sure who that is.
Sorry about that. Good evening, everyone. Thank you for passing that along, Lauren. My name is Veronica, and I am currently a Los Angeles and Central Coast Chapter Board member, as well as the California Public Policy Committee Secretary. That was a mouthful. I am honored to be here and speak on behalf of AFSP as an advocate for policies that support suicide prevention. Today, I'll be talking about AB 1394, which covers suicide prevention in health systems. Through research, we have learned that those with increased risk of suicide can be detected through early detection methods, and specifically those methods in health systems. One statistic has found that approximately 40% of those who die by suicide previously visit an emergency department, or ED for short, for non-mental health reasons. So that means that individuals who are facing mental health conditions like suicidal thoughts are visiting EDs for other reasons, but unfortunately, they're going through these systems undetected. In fact, only half of those that pass away by suicide who have visited an ED within a year of their death were recognized as having had a mental health problem at their visits. Overall, between 6 to 10% of all ED patients are experiencing suicidal thoughts. Suicide prevention in health systems can save lives, and they can do this through screening and assessing individuals by asking those individuals if they are experiencing suicidal thoughts. A lot of the time, people who are experiencing suicidal thoughts will not disclose that unless they are asked. What AB 1394 offers to do is to create an opportunity for us to treat individuals in the highest and most immediate risk for suicide. AB 1394 was authored by Jackie Irwin. She is a member of the California State Assembly and represents District 44. What does AB 1394 say that it will cover? It will require general acute care in hospitals and adopting universal suicide screening and policies and procedures. Secondly, it would require screening for suicide risk, which would take the place as part of overall medical screenings. Those who show signs of suicide risk would have to be given information about crisis hotlines and referral lists for community mental health agencies. Hospitals would also be encouraged to adopt guidelines regarding screening for suicide risks and protocols to follow up when a patient exhibits signs of being an imminent risk for suicide. Lastly, I just want to mention that this is the first bill of its kind that AFSP is supporting. So we look forward to seeing how this bill will get supported in the future through our projects of 2025. Thank you.
And hello, everyone. My name is Erica Brown. I am the Area Director for Greater Sacramento and Central Valley chapters. Thank you once again for joining us this evening. I just want to now discuss how you can take action over the next few weeks in support of the policy priorities we reviewed during today's event. Every advocate has received an email from the AFSP Public Policy Office promoting you to visit the AFSP Action Center to email your legislators in support of the policies discussed today. For those looking to take additional action, we can work with you to schedule a phone meeting with a legislative office. You may share a personal vignette that we will review shortly, and at any time, you can promote suicide prevention and positive mental health on social media, tagging your legislators and AFSP. The Public Policy Office has set up an action on the AFSP Action Center that is directly related to today's event. Advocates are directed to the AFSP Action Center at the link you see here, and you can email your legislators in as little as 2.5 minutes. The Action Center is pre-programmed with letters to elected officials, which are then populated with your contact information and any personalization you wish to add. Don't forget, you can also share the general link to the AFSP Action Center that you see here on the screen, afsp.org/action center, on your social media outlets and encourage your friends, family, and the community to take action today. For those interested in meeting with a legislator and/or their staff over the phone or in person, there are a few things to keep in mind. First, practice your elevator speech as we discussed prior and make sure that you feel comfortable briefly sharing your story. One easy way to practice is by filling out a written vignette that can be shared with a legislative office before or after the meeting as an email attachment. The vignette includes a photo of you and your loved ones and a few sentences about why suicide prevention is important to you. Typically, legislative meetings are about 10 to 15 minutes in length, so you may not have time to talk about each priority. That is why we encourage advocates to select one area from the issue brief that they are passionate about and talk about that during your meeting. Legislators will receive an electronic copy of the issue brief from you and from us. So if you are not able to talk about each priority, that is okay. Finally, don't worry. If you receive a question that you do not know the answer to, simply say you don't know, but we will be happy to find the answer for them and follow up. This gives you an opportunity to stay in communication with the office, build your relationship. The Public Policy Office is happy to work with all advocates to help answer these questions so you can follow through on your promise to be a resource for your legislators. After meeting with a legislative office, it is important to follow up and offer yourself and the chapter as a future resource. You should send a personalized thank you note and a copy of your vignette if it was not shared prior to the meeting. The vignette provides the legislator and their staff with a name, a face, a story, and ultimately a reason to vote in support of suicide prevention and mental health. For those who indicated on their registration that you were interested in scheduling a phone meeting with legislators, we have a few final reminders. You should have received an email from the chapter that includes the name and contact information of the legislative office you are assigned to meet with, a sample meeting request that you can use to get your meeting scheduled, a link to the legislative meeting feedback form so you can share information about what was discussed on your call and if any follow-up is needed, and a sample thank you note to send after your meeting. We can also assign a partner for any advocate that may be unsure about meeting with a legislative office alone. And if you did not receive this information or no longer wish to have a legislative meeting, you can email Megan Cohen at mcohen@afsp.org. And we just want to thank you all again so much for joining us for today's California State Capitol Day. If you have any questions, feel free to put them into the Q&A. And we also have listed here all of the different contacts for each of the different chapters here in the state of California that you can reach out to should you have any further questions or concerns. There have been some questions answered already in the Q&A for anyone that might be checking that out. Thank you so much, Lisa, for helping with that. I guess we can give it a minute to see if anyone else has any other questions.
Leo.
Doesn't seem like it so far. So thank you all so much for joining us tonight. We will be following up with an email that has all of this information. But if you do have any questions or concerns, feel free to stay on the line, as we will also be on here for a little while after. But thank you so much again, and we hope that you all have a great night.
So we did have a couple questions pop up, and I'll just address one of them, and feel free if anyone else wants to hop in and address any of them as well. So Gordon, I spotted your question. Are we going to be writing support letters and enter them in the portal? You should have received an email earlier today from AFSP with the Action Center to encourage you to submit through there. And if you are interested in doing more than that, make sure you will be getting contact from folks in your chapter, and we can get you some more activities to do as well.